Question 35. A patient is experiencing recurrent episodes of vomiting over an extended period, possibly lasting for months. Following each episode, they feel hungry and resume eating. Physical examination does not reveal any significant findings, and there has been a slight weight loss of 2 kilograms since birth. What is the potential diagnosis? Option A: hypertrophic pyloric stenosis. Option B: cyclic vomiting syndrome. Option C: gastric volvulus. The correct option is B: cyclic vomiting syndrome. Cyclic vomiting syndrome is characterized by recurrent episodes of severe vomiting, which can last for hours or even days. The episodes are often followed by symptom-free intervals. Patients may feel hungry after vomiting and resume eating. The syndrome can be associated with normal physical examination findings and only minor weight loss, making it a relevant consideration in this scenario. Hypertrophic pyloric stenosis is typically seen in infants and presents with projectile vomiting shortly after feeding. The intermittent nature of the symptoms in this case is not characteristic of gastric volvulus. Question 36. A newborn delivered at 38 weeks with a weight of 1.8 kilograms experiences jitteriness, hypertonia, and a brief seizure lasting a few seconds. All laboratory results are within normal limits, except for a glucose level of 2.5 millimoles per liter. What is the next recommended step in managing this situation? Option A: administer glucose. Option B: provide IV diazepam. Option C: administer IV antibiotics. Answer is option A. The baby's symptoms of jitteriness, hypertonia, and seizure along with a low glucose level suggest hypoglycemia. The primary intervention for hypoglycemia in a newborn is to administer glucose to raise their blood sugar levels to a normal range. Other options are irrelevant to the description. Question 37. A 9-year-old child visits for a pre-sport checkup and is found to have a fixed wide split-second heart sound and a second-degree ejection systolic murmur at the upper left sternal border. The ECG results are normal. What is the most suitable step to take next? Option A: treadmill exercise. Option B: diuretic and angiotensin converting enzyme (ACE) inhibitor. Option C: cardiac referral for further assessment. Option D: reassurer and discharge. Correct answer is cardiac referral for further assessment. Explanation: the fixed wide split-second heart sound and second-degree ejection systolic murmurs suggest a potential structural or functional abnormality of the heart. In a child, such findings could be indicative of a congenital heart condition or another cardiac issue. Given the presence of these findings and the need to ensure the child's safety during physical activities, the cardiac referral for further assessment by a pediatric cardiologist is the most appropriate step. The other options are not the primary recommended steps in this case. Treadmill exercise is not appropriate without a comprehensive cardiac evaluation, as there could be underlying issues that need to be addressed before engaging in physical activity. Diuretics and angiotensin converting enzyme inhibitors are not indicated based solely on the provided information. Reassuring and discharging without further assessment could potentially overlook a significant cardiac issue that may need attention. Question 38. A 31-year-old woman is experiencing emotional symptoms that occur 3 days before her menstrual cycle. These symptoms include low mood, reduced activity, and significant lower abdominal and back pain during the first 3 days of her cycle. These symptoms are impacting her work and social life. What is the recommended evidence-based medication to prescribe? Option A, oral combined contraceptive. Option B, progestin-only pill. Option C, SSRIs. Correct answer is option C, SSRIs. Explanation. The symptoms described are consistent with premenstrual syndrome, and in more severe cases, premenstrual dysphoric disorder, PMDD. Selective serotonin reuptake inhibitors, SSRIs, have been shown to be effective in managing the emotional and physical symptoms associated with PMS and PMDD. They can help alleviate mood-related symptoms and improve overall functioning. Oral combined contraceptives can also be used to manage PMS symptoms. But SSRIs are specifically indicated for mood-related symptoms. Progestin-only pills primarily provide contraception and may not be as effective in managing the emotional and mood symptoms. Question 39. A 60-year-old female who is postmenopausal presents with a lump on the vulva. She complains of itching, and after scratching, there is bleeding. On physical examination, the mass is described as pea-like. What is the likely diagnosis? Option A, squamous cell carcinoma. Option B, Bartholin cyst. Option C, Bartholin carcinoma. Answer is Bartholin carcinoma. Explanation. The presentation of a postmenopausal woman with a vulvar lump associated with itching and bleeding raises concern for Bartholin carcinoma. This malignancy can cause changes in the vulva, including the development of a mass, itching, and bleeding. While Bartholin cysts are common benign lesions that can cause a lump on the vulva, they typically do not present with bleeding or itching. Squamous cell carcinoma is another possible vulvar malignancy, but the given presentation of a pea-like mass and itching is more indicative of Bartholin carcinoma. Question 40. A mother who is 2 months post-delivery undergoes urine culture screening, and the results show more than 100,000 E. coli bacteria. The E. coli is sensitive to ciprofloxacin, nitrofurantoin, trimethoprim, and sulfamethoxazole. The mother is asymptomatic. What is the recommended treatment approach? Option A, ciprofloxacin. Option B, nitrofurantoin. Option C, trimethoprim and sulfamethoxazole. Option D, no need of any medication. The correct answer is option D, no need of any medication. Explanation. In asymptomatic patients, treatment for asymptomatic bacteriuria is generally not indicated, especially in cases of postpartum asymptomatic bacteriuria. Asymptomatic bacteriuria does not require treatment unless the patient is pregnant or undergoing urologic procedures. Treating asymptomatic bacteriuria in non-pregnant, non-urologic procedure patients can lead to antibiotic overuse and contribute to the development of antibiotic resistance.